Are you feeling a deep pain in the groin region, instability or clicking through the hip? If so, there is a chance it could be a labrum tear, and this video may be beneficial for you. Today we are looking all at what they are, common causes, and then the best exercises you can use to get yourself back on track. So what is a hip labrum tear? So a hip labral tear is a tear in the labrum. And the labrum is a ring of cartilage that lines the edge of the hip socket, otherwise known as the acetabulum. This kind of acts like a seal and a cushion. So it helps to stabilize the hip joint and it allows for smooth movement. So when the labrum does tear, it can cause obvious pain, instability, and reduced range of motion in the hip. So what are the common causes of a hip labral tear? Repetitive overuse. So running, twisting, dances, it's all common in these activities. Trauma is another one. Structural issues. Now, this is one of the more common ones I see in clinic, and when we talk about structural issues, this is hip impingement. And if you haven't seen, we have a hip impingement video on this channel. I'll link it in the top corner here for you guys. Hip dysplasia is another one, which is just another word for having a shallow socket in the hip. And the obvious one, degeneration. Same as in the labrum in the shoulders, with age comes degeneration. The wear and tear on these hip joints or hip sockets can start to take its toll. What are the signs and symptoms of a hip labral tear? So the number one is pain. And this pain can be, like I said before, deep in the groin region. Pain that is worse with sitting, rotating the hip, or walking. Also a clicking, locking, or catching sensation upon trying to do different movements. Stiffness and reduced hip range of motion, and a feeling like the quote unquote, the hip is giving out. Now, so if you're someone that is at home and you want to self-test yourself, I'm going to show you today. This is a basic one. It doesn't always mean that you've got a hip labral tear, but this is one test we do in clinic. Okay guys, so we're going to be laying down, both legs straight out. The affected side, we are pulling the hip into flexion. Now, sometimes with a labral tear, this will cause pain. If it's okay into flexion, then we're gonna add what we call adduction. So bring the knee into the center line a little bit more. And then if that's still fine, we can add a little bit of internal rotation, which is simply levering the knee, pulling the knee in, the ankle out, and that's internally rotating. We call this test the Faddeer test. The other simple one is resting the ankle above the other knee and letting the hip sink towards the outside. If you start to get pain deep in that groin region, this is another test that could mean that you have a labrum tear. So you've established you have a labral tear. What do you do next? So we're going to go through some really basic exercises to start off with, and then a little bit more advanced ones that are more later stage rehab. Remember my golden rule: if there is pain, don't try and complete the exercises with pain. So for our first one, we are going to be laying on our back on the table, arms beside us for a little bit of support. All we are doing here, we're going to do 5 repetitions of lifting the leg straight up. Now this may cause, if there is pain and it's too much, you're not ready for it yet, we're going to have to wait and let the labrum heal a little bit more. Now if you're fine, what we're going to do in this position is keeping the leg straight, externally rotate it as much as possible. Hold here just for 5 seconds. Internal, slowly down, have a little rest. So then same thing again, straight leg up. Now internal, holding it into internal. 5 seconds, bring it back to neutral, slowly drop it down. So that's 1 repetition. We're doing external, internal, that's 1. We're doing 5 in total, holding for 5 seconds. So up again, externally rotate, holds, 4, 3, 2, 1. Back to neutral, slowly drop. Make sure you don't arch your back, so you're locking that back down into the table. Straight leg lift, internal rotation, holding, 4, 3, 2, and 1. Back to neutral and down from there. Now, while we're on the table here, a big one we want to focus on is the glutes, strengthening the glutes. So we are going to start with a little glute tuck. So we're using both legs here, driving the weight into the heels, lifting the hips off the table, trying to tuck that pelvis under, tuck that tailbone under, hold at the top here, hands on the table for 5 seconds, as high as we can get those hips up towards the ceiling. and then slowly roll the spine back down onto the table. So once again, rolling the spine up, driving the weight into the heels, tucking the pelvis under, and after 5 seconds, slowly, the very slow release, rolling the spine back down, and just like that. So we're doing 10 repetitions there. Now, if this is pretty easy, the next level that we can do is single leg. So same thing here, one leg kicks out straight, driving the weight into this right heel, arms beside you for a little bit of added support, weight into the heel, lifting the hips off, trying to get this, keep this leg out straight, but keep the hips level, so you're not rotating one way or rotating the other way. And then once we're at the top here, guess what we're doing? Yes, we are tucking the glute under. So try and tuck that glute under, hold for 5 seconds, and then slowly drop down with that single leg. So that will be a lot more aggressive, and that may be, you may need to wait like 4 to 6 weeks before you start to do that, but that's what we want to get to towards the end stages of rehabs. We are going on our sides. Right, so what we're going to do here, laying on our side, supporting our head, the bottom knee is going to be slightly bent for a little added support, kicking the top leg straight. Now, before we start to lift, we're going to do a little tweak here that helps to get this hip stabilizer muscle firing a little better. And all we're doing with this tweak is internal rotation. So kicking the heel up towards the ceiling, keeping the leg straight, lifting as high as we can, holding at the top here. You're probably going to feel that the side of your bum is firing, that hip stabilizer muscle, the gluteus medius is working hard, and then slowly down, very slowly down, and having a little rest at the bottom. So 5 second hold up, 3 to 4 second release down. We're doing 10 repetitions. Up again, kick that knee straight. The higher, the better you can go with this one. Make sure the heel's closest to the ceiling. So we're like internally rotating that foot, and then slowly down after the 5 second hold up. All right, so the next one, we are gonna go into a kneeling position. Now, the best thing to focus on here, with this one, is imagine that you're drawing a giant circle with your knee. Same thing, if there's pain or you go through a certain phase of the motion and you feel like a clicking with associated pain, you're not ready for this one, or decrease the amount of range of motion that you're moving in. So, hands right under the shoulder. From here, we're going to kick the leg back as far as possible. My table's a little shaky right now, actually. And then from here, drawing the biggest circle we possibly can with that knee, bringing it forward, all the way back, externally. So once we get all the way back, that's glute control. We're externally rotating the whole hip, coming out to the side there, slowly down. So coming back, big circle, slowly going down. As we do this, we don't want the hips rotating out. We want everything still facing the table and the hip doing all the work for us. Okay, so 10 repetitions with this one, guys. Okay, guys, so for the next one, I'm using a Pilates ball. If you don't have a Pilates ball, you can deflate a little bit of a basketball, deflate a soccer ball, a volleyball, whatever you've got at home, and place that between your knees. It works exactly the same. So, for this one, we are laying on our back. We're gonna have our hips at 90 degrees, knees at 90 degrees. Make sure there is no pain here. Ball is going between the knees. Now, once it's between the knees, we're gonna try and squish this ball as hard as we can. So you're gonna feel that these adductors, the muscles on the inside of the leg, they may start to shake without even moving here. Now, locking that lower back into the table, we are going to slowly drop one leg, just an inch, and then slowly lift the other while we keep trying to squeeze the ball. So imagine that we're trying to pop the ball. Move one down, move one up. So we're going to try to get to 12 repetitions here, very slow. Okay guys, so for the last one, we are using a towel on timber, tiled floors, whatever flooring you can find that is a little bit slutty. So as you can see here, I've got just a little bit of floorboard here. We're going to place that towel here, and that's going to be the leg that's going to be sliding. Now all we're doing here, so we're going to do this on both sides, but we're going to, say if it was the left labrum. So all we're doing here, guys, is slowly dropping down into a slider reverse lunge. Now if you look forward here, we want to make sure that this knee is behind the toes. So as you start to come up here, we're going to use this big glute max, so the bum muscle, to drive the hips up, push the hips forward. So once again, we're trying to go 8 to 10 reps here, slowly dropping down, and then keeping the control, slowly coming up. So I'm just going to show you face on here as we drop down. If you look down, we want stability through this lower limb. So if you start to see your knee pull going in, your ankle rolling in, your hip coming out, try to slow things down, pull things back into alignment, and do things from perfect line. So this, if you look down, your hip bone, your mid-knee, mid-ankle are all in one direct straight line, which means your stability muscles are actually working. So once again, we're going 8 to 10 reps, slowly down, driving up through that glute at the top, trying to tuck the glutes in and under a little bit. If you need a little table or something for stability in front of you, make sure you hold that. But remember, this foot in the back isn't actually lifting off the ground. It's sliding along the ground, and that weight is pretty much all through that front leg, but we still have contact with that back foot. So slowly down, driving the hip up, and then making sure that we complete this on both sides. Okay guys, I hope this video has been beneficial for you. If you're recovering from a hip labral tear, I really hope that you can get back into what you enjoy doing the most. Remember that consistency is way more important than one big session a week. So add a little bit of this in every single day. And remember, these videos drop every single Monday at 7 AM. So be sure to check out what's to come and share these with friends. Enjoy guys, we'll see you next week. Take care.